Hi, I am Caitlin over here at TherapyWorks, and today I'm joined by one of our PTAs, Mike, and he's here to talk to us for Physical Therapy Month, which is this month. So we're going to be talking and just kind of answering some frequently asked questions about physical therapy, and yeah, so just to kind of kick it off, Mike, could you tell us a little bit about what makes physical therapy different from other medical specialties?
So as in physical therapy, we are the musculoskeletal specialists, right? So if you go like your family practice, like I'm sure they had a unit or two in it or whatever, the doctors, but we're trained specifically and intensely in it. So we are trained a lot on, like I said, not just muscular and skeletal systems like nerves and everything else, but really specifically into those areas. So I don't know,
Right.
it's the most fun.
Fair. And you learn about the rest of the body, but it's all about how it supports the musculoskeletal system.
For sure.
At least, I mean, I don't know. I haven't.
No, but you got
it's
it.
not my specialty, so you know better than I do.
For sure.
Yeah, and I think that unlike a lot of other medical specialties, it is both non-invasive and non-pharmaceutical.
Yeah.
Because a lot of specialties rely really heavily on drugs or procedures that are invasive, and most of what you guys do is not that. It's kind of like a natural alternative to a lot of those kinds of things.
For sure, especially a lot of doctors will send patients to us for conservative therapy just so we don't have to be invasive, so we can do the basics and see how it's dealt with and then go from there. And then if it's something that needs more attention, then we can refer back or whatever.
Yeah, absolutely. I mean, pain medications and surgeries, they're always going to be an option. So it's, oftentimes best to start with something that doesn't come with those kinds of side effects and that kind of recovery time and those kind of, potential for addiction and things like that.
Absolutely.
Not like you're going to get, addicted to stretching.
I mean, I have seen it. I've seen it.
I mean, there are worse things though.
Fair.
So, what kind of with that kind of tool set, what kind of conditions can you guys treat?
We can really treat anything. I mean, headaches, chronic pain. We can teach even if it's something that's structural, that's problematic, we can teach kind of ways to compensate. So just for better quality of life, there's really not a limit. I mean, if it's like your organs are combusting or something, then yeah, that's a doctor thing, right? But I mean, if it's anything, like I said, musculoskeletal, I mean, even like vertigo, which is, I mean, there's a gamut of things we can toy with and work with and actually, I mean, dare I say solve, but really assist, right?
Yeah, I mean, so many people think of physical therapy for knee pain or back pain, which is a huge part of what we see, but things like incontinence or balance problems or like you said, headaches. I mean, those aren't things that people would think of physical therapy for. I don't know. I love that you guys can do so much. And honestly, it's kind of hard for people on my side of things who, I'm not, PT or PTA. I don't know, it's hard for me to know, what can you guys help with? You know what I mean? Because I'm not trained in how are they connected, what is actually causing these kinds of things.
I would tell people to do literally do your research, right? If you're curious about it, if it's hurting, especially if it's a headache or something, if you Google, it sounds silly, I don't like Dr. Google either, but if you do, and most people do, remedies for whatever, I would say most issues have physical therapy in there, right? And the very least, it's going to be the easiest, right?
Yeah.
So,
and if it doesn't work, and that's the other thing is it's also not that expensive either. I mean, it's not free, but it's way less expensive than a surgery or ongoing medication or something like that. So talking about low entry, just starting with something very basic and very easy, if it works, it's perfect.
Exactly.
So, when you guys are treating those kinds of conditions, what does the average treatment usually look like?
So we'll do, I mean, depending on what it is, I mean, we'll do a lot of hands-on stuff, manual work, see if we can't loosen things up. A lot of people don't realize the motion that they've lost, right? So after that, we'll do stretches, we'll do exercises. We'll progress those stretches and exercises. It's really, people think that it is one of those, it's a short, kind of quick, people are really skeptical about it. Like therapy is really, it can be intense. It can be, and you have to do your homework, right? That's super important, right? Like,
yeah.
If you don't hear anything else I'm saying, do your stretches outside of this, right? I wish they would call us progressive therapists instead of physical therapists, because the actual work is done at home once we give you the exercises. And what we do is we help, we progress those exercises so that you improve, right? But you got to make sure you do the baseline part. So super important.
Yeah, absolutely. And I think that people don't always realize like how much measuring and stuff like that you guys actually do. Like you guys test so much to make like it's not like, oh, our patients kind of feel better. Like you have to do objective measurements at like regular intervals in order to like demonstrably show that like your patients are improving.
Per insurance, per doctor. Like, I mean, if it's an orthopedic issue, like they want to know, like, especially in the beginning, like almost every visit, how much has changed. Like it's everything is measurable. And if it's not measurable, you're going to the wrong person, right? It has to be.
Absolutely. So yeah, so and I think another thing that people don't realize is like how much, like sometimes people think that it's just, like just stretches and exercises. Could you talk a little bit more about like what's going on your end and why, like just stretching on your own at home is not the same?
So first of all, stretching, a lot of times people have it all wrong, right? It's either you learn stretching when you were like in school from some teacher or whatever, or maybe it's an athletic trainer, and that's great. But a lot of times where we're coming from, our side of things is like where the injury originated, right? If you had, like my son is 11, he's broken his collarbone already, right? He may have issues. He's a baseball player, he's left-handed, and he throws with that arm. If he has issues later on down the line, it makes sense to go all the way back to when he was 11 and look at, oh, well, he broke his collarbone skateboarding or whatever. This injury is significant. What was the mechanism, et cetera, et cetera. And that's how we kind of break it down, right? If you come in, you're like, yeah, when I was 12, I had a thing, or had a car accident when I was 25 and my hip kind of felt weird then, potential that it started then, and you've just compensated all these years. And so our job is to help stop that compensation, help strengthen muscles and all the things around it to better quality of life. I mean, it's all about that. So
right, like I mean, and anyone can do like a number of stretches for their shoulder, but if you don't have that history and you don't have the training, you don't know which specific parts need to be strengthened and how. And like, and I mean, I've worked here for quite some time, and even I am like still learning things. I had a Facebook Live a couple weeks ago with Brittany on like TMJ, so like jaw pain, and she was talking about like neck exercises for that, and like I had no idea. Like I never would have thought like, my jaw feels stiff, or like my jaw's popping when I open my mouth, I should exercise my neck. Like that never would have occurred to me.
I'm gonna spare you the singing, but do you remember that old, the neck bone's connected to the, that's a thing. That's real, right? That's a real thing.
For sure.
It's really, and everyone, oh my gosh, everyone stretches wrong. Like literally everybody, right? So like, usually my first couple of sessions are showing them exactly how to move, where their neck should be, their posturing, all the things. And then they're like, you know what? That actually works. My favorite word in therapy is actually. Yes, it does work. Actually,
it's funny how many patients walk in our doors just not even believing that we can help them. Like it actually, like, it's kind of shocking sometimes, but making Lawrence believe one patient at a time.
Yes, ma'am.
So I guess like that kind of brings us to walking in the door. When you're choosing where to go for physical therapy, like what kinds of things should you look for? Like what makes a physical therapy place good for you?
I mean, honestly, as long as they're hands-on, as long as they're, I mean, it sounds silly, competent, right? As long as they're not, for me, as long as people aren't on top of each other, right? Like it's you have your designated space, you have your designated, professionalism. I mean, you can come to therapy. You don't even need depending on your insurance, you don't even need like a referral from the doctor. Like Kansas is a direct access state. So like if you have like Blue Cross Blue Shield, you can just come in and take a look, right? Like come in, check in, or ask the front desk about what's going on here. I mean, for me, the patient, and it should be for everybody, the patient is always right. Like you know, the patients are the most important thing. So when they come in the doors, we have to do everything we can to show them that we have the skill set to help them for whatever they need, you know?
Yeah, and I like that you mentioned like hands-on approach, because I think that we kind of glossed over that a little bit, you know, when we talk about stretches and exercises, but so much of what you guys do really is hands-on. You know, if you're just stretching, you're never going to get as deep or in the right spot exactly. And like, I mean, there's just so much value to that hands-on approach. And I've kind of been surprised with, you know, talking to people who have gone to physical therapy in some other places that not everybody does that. It's like they're doing like half of physical therapy, but you better believe they're paying for all of physical therapy. Why would
it's a time thing? It's a time thing. They got to get to whatever they have to get to, and they forget that. So if you come in as I tell people all the time, a concrete block, right? Once I get my hands on you and I can loosen that tissue up, then we can stretch, and then you'll actually move, right? Otherwise, for stretching, like you have to be warm and that'll take a second, right? But if I can get my hands on you and move you around and then stretch you and then strengthen you, we are exploiting the range, like the new range that we have achieved. Right. And there are a ton of places that don't do that. They don't have time for that. They want you to come in, do your exercises so they have your outcomes, and then you go.
Well, and for every moment that your like therapist has their hands on you, you are their sole focus, and that's expensive.
Yeah.
But like we eat that cost because it's worth it, you know. I say expensive. It's expensive for the clinic. It's not expensive for you. It costs the same.
Right.
So, you know, we kind of talked about like choosing a place for physical therapy, but like how much choice do like patients really have? Like, are they allowed to go wherever? Like, how does that work?
Yeah, you can. I mean, a doctor writes a script. Like I said, Kansas is direct access. So if you have like Blue Cross Blue Shield, you can go without even seeing a doctor. But typically, if they're doctor,
even if you don't have, I want to jump in. Even if you don't have Blue Cross Blue Shield, you can go without talking to a physician first.
Sure, absolutely.
It's just your insurance won't cover it unless you get a physician referral. But most physical therapy places, including us, can help you get that.
Correct, and you should be able to go. The customer is always right. That sounds silly. It's an old sales adage, but it's true. So like, you know, go to a place, and if you don't like it or you don't feel like you're being treated, go somewhere else. Like you can go wherever you want. You're the boss, right?
Yeah.
Like,
I think some people don't realize, you know, because like often physicians will refer them to like a specific place for physical therapy, and they think that that's where they have to go.
Yeah, but that's why the reason why is because that physician probably has connections to that place, and that's great, right? They have a working relationship. That's good. That's what we need. But that doesn't necessarily mean that place is right. You know what I mean? They may not have the equipment that you need. You know?
Yeah. Well, and like there are. You know, I don't want to like name any names, but there are definitely some relationships, even in Lawrence, between like certain physical therapy places and physician like offices. And even if your physician doesn't believe that that's the best place for you to go, sometimes they have administrative pressure on them to refer to a specific place. So it is like, you know, I mean, like, I'm in the process of buying a vacuum, and you better believe that I'm doing my research to make sure that I'm buying the right one. And when you're trying to purchase like health and healing, that decision is so much more important. And like just trusting someone else to make the best decision for you and for what your body needs, like that person has seen your body a little bit of time, but you have to live in it every single day.
Right.
So like finding the right fit that's going to help you get where you want to go is so critical in making sure.
It's like clothes. It's like clothes. You know what I mean? Like if you get, that's great, but not all joggers fit the same. You know what I mean? Like they don't. You know, some things. You know. So it's the same thing. If it's not the right thing.
Trying to picture you wearing my cardigan, Mike.
Exactly. No, right? No, not a cardigan guy. Not a cardigan guy.
Don't hate on cardigans. Yeah. So this next question is like kind of personal, but like what, I mean, not personal, but like specific to you, just like what do you wish more people knew about physical therapy?
I wish people knew that it takes a little while, right? I wish that they knew that it'll be all right. and to just give it a shot. I wish people knew that it is really important to do your exercises outside of the clinic, right? I wish people knew that. I mean, I wish there's so many things I wish, you know. I wish people, I think the biggest one is even if it feels like it is something that's been plaguing you your whole life, give it a shot. What's the worst that can happen? You know what I mean? Nothing. Okay, well, you're used to that, right? But what happens if something happens, right? I've seen patients. I had a patient years and years ago who had diabetic neuropathy down her legs, and they told her when she was 16 that she would never walk. And I met her when she was 65, and she couldn't feel her feet when she was walking.
Wow.
But she walked, right? And
that's so cool.
We worked on other parts, other segments of her body to help compensate for the things she can't feel. And to my knowledge, she's still walking. So,
you know, and that's amazing, you know, like, and not, that's the thing about physical therapy is that not every patient is going to, you know, have the miraculous, sorry, it's been a long day, but not every patient is going to go from inability to walk, inability to lift their arm, inability to, you know, that level of, you know, struggle to all the way being able to walk, being able to. But if you talk to anybody who works in physical therapy, everybody has a story like that. Like everybody's had a patient that's made those kind of gains, and everyone can tell you 50 more stories that sound less miraculous when you hear about them, but are no less meaningful to the person who experiences them.
Correct, for sure, absolutely.
You know, to like say like, she had headaches every day and now she doesn't. Like that doesn't sound as, you know, sexy as, you know, couldn't walk and now does. But for that person, you better believe that that makes every difference in the world.
Oh, what I guarantee, most people suffer from headaches, they get it, right? Like it's important. Or like, you know, like leaking if you have a pelvic floor or an incontinence issue, you know what I mean? I mean, like maybe you don't have to wear something like it depends, but but you don't leak anymore, right? Like maybe it's something small and then it's gone altogether. That is huge.
Yeah.
Now you're not afraid of laughing in public, you know? It's a big deal.
Don't have to cross your legs when you sneeze.
Right. You know.
By the way, that's not normal. Even if you've given birth, it's still not normal.
Absolutely.
I like to throw that in whenever it comes up because I hate that that's being so normalized. Like, nope, we can help. Yeah. So I guess that kind of gets to the next question, which is like, how do you know if it's like bad enough for physical therapy? How do you know that it's time to go and like seek help?
I mean, I would tell people we're pretty symmetric as human beings, meaning like, you know, each arm moves similar, each leg, unless there's something, you know, some sort of a problem at birth or whatever, right? So like if you turn your head one way and this side of your neck is hurting and you can't turn it that far, like there's probably something going on, right? Or if you take some ibuprofen or some other thing and it's still coming back, then it's worth a shot, especially if it's musculoskeletal, especially if it's a limb or your neck or your shoulder, you know, it's worth a shot to figure out what that is, you know?
Yeah, absolutely.
Don't wait forever and ever, right? And if you do wait for ever and ever, like still give it a shot. What's the worst that can happen? Truly.
True.
You know what I mean? Like it's already hurting, right? Maybe we can show you ways to make it hurt less. I see people all the time. This is a little tidbit for everybody, right? If your knees, I see lots of people that have degenerative knees, right? If your knees are busted up, or you're bone on bone, work your glutes because they offload your knees. And then all of a sudden, it doesn't hurt as bad to walk as long, right? Is it going to fix the degeneration? Probably not. But at the very least, it will take the pressure off. It'll give you a break, you know?
Right.
And then it just prolongs things, you know, your longevity is better. Quality of life, again, is better, you know? Absolutely.
So, you know, I mean, and just to kind of like bring it back around, if it's still bugging you after you know, a few days, a week, there's no reason not to get it checked out. And, you know, and this is where I always like to talk about like our complimentary consultations. I think that they're just like the greatest idea because we offer complimentary consultations where you for free can talk one-on-one with someone on our physical therapy staff and get and you can tell them what's going on and get their input. And like, it's a hands-off consultation, but they will listen to you, ask you the right questions, figure out where you're at, what you've tried, what you haven't tried, and they'll point you in the right direction. So if it's physical therapy, that's great. We can help you out. We can usually get you in pretty quick. And we can help, like we were talking earlier about some insurances require a physician's referral. We can help to streamline all that paperwork for you so you don't have to worry about it. But on the other hand, if it's not physical therapy, that's the right next thing. You know, maybe you need to go and talk to a specialist. Maybe you need to go back to your primary care physician. Maybe you really need x-rays because that sounds like there, you know, might be something else going on. Then we can refer you back to, you know, wherever you need to go. And TherapyWorks has been operating in Lawrence for 29 years now, 29 years. So like, we know where the resources are, we know the other players, we know what options you have and what's nearby. So we can help you get connected to, you know, whatever's the right next step for you. But like, no matter what, you'll know that, you know, when you walk out of the door, you'll know what you need to do next to really get a handle on your pain or your dysfunction or whatever you're dealing with. So,
there's
you know,
there's no other place that will let you have access to a licensed professional for free.
Right.
You can't do it with your car.
And we talked earlier about like, how would you know that if you weren't watching this today, how would you know that we treat, you know, incontinence or headaches? Well, the way that you know is that you come in and you ask. And yeah, they're completely free. They're pretty quick. So it's not a really big commitment. It's just a really great time to go and talk to someone that is, you know, really knowledgeable and can help point you in the right direction. We do have a complimentary consultation day coming up on November 3rd, which is like awesome. Our therapists always have like extra time to talk, and like the consultations on that day are usually a little bit more thorough. So you get a lot more like bang for your buck, but your buck is nothing, it's free. So if you'd like to schedule a slot for that day, they are going pretty quick, but if you'd like to schedule, you can give us a call at 785-749-1300 and we'll put you down. If you're not available for that day or would like to come in on a different day or would you like to get in sooner, we can also make that work. So yeah, I always just like to bring those up because like they're so useful. And like, honestly, if you're here, you're probably experiencing something where like you would like a little bit of help on it. So kind of, you know, back to like a little bit more on the physical therapy topic, Mike, you know, we've talked about like different, you know, what you guys do, what you guys can help with, how you guys help, and how to choose where to go. Now, once someone is already going to physical therapy or when they're like considering physical therapy, what can they do to make sure that they're getting the most out of, you know, the time and the money that they're investing in their health?
Please do your exercises at home.
Wait. Are you saying that you want people to do their exercises at home?
Yes, that's a big deal, right? Because a lot of times people, well, you know, life happens and I get it, right? But if you really want to get the best bang for your buck, especially if you're in therapy, do the stuff at home. You're establishing a baseline for strength and mobility, and then we can continue to build on that instead of always, if you don't, then we have to go back to square one every single time, right? As opposed to building and meeting your goals.
Yeah, and I imagine the same thing kind of goes for like skipping appointments and canceling.
Yes.
Like,
yes. Again, life happens and I get it, right? Yeah. But if it's like, man, it's really early, I mean, how bad are you hurting, right?
Yeah.
You know?
Absolutely. So, you know, lots of great advice, lots of great input today. Is there anything else you'd like to say before we sign off, other than do your home exercises?
I think, have I said that? Yeah, do your home exercises. Have I said that?
You might have mentioned it.
Yeah, good idea. It's a good idea.
All right. Well, yeah. Well, thank you so much for joining us, and hope you are having a wonderful physical therapy month. And looks really enthusiastic. But yeah, so anyone who, if you were listening today, and like I said, the number to call for those complimentary consultations is 785-749-1300. And we hope to help you out soon. Thanks so much for joining today.